Let's Talk About Kidneys takes a deep dive into the chronic kidney disease patient journey. We're here to inspire meaningful conversations and to help people living with CKD gain a full understanding of their disease. Join us to learn about the different over-the-counter medications and how to choose the right medications for your symptoms if you have kidney disease. Welcome everyone to today's topic. Our nephrologist that we have that is our specialist is Dr. Richey, and we will be discussing over-the-counter, prescribed, and herbal supplements. Welcome, Dr. Richey. How are you today?
I'm good. Thank you for having me.
Good. So let's jump right into it. What over-the-counter medications do patients need to be aware of if they have chronic kidney disease?
So, as you know, there's a lot of different over-the-counter medications, but we try to be very specific with our patients as far as what they need to avoid. So, I would say the first and by far the most important class of medications we want to tell our patients about are the non-steroidal anti-inflammatory drugs. We call these the NSAIDs.
The NSAIDs.
Mhm.
Okay. And so can you give me some examples of some NSAIDs?
Yeah, so the most common ones we come across, Ibuprofen, Aleve, Motrin, Naproxen, these are all the over-the-counter versions. Even aspirin and BC powder do fit within this category. And then there's some prescription medications like celecoxib or meloxicam that also fit in this category.
Okay. So if a patient is having different ailments, are they able to use them all?
They can use them sparingly, all right? The issue is daily usage for our patients. So using these medications on a daily basis can be very dangerous for patients who have kidney disease.
Okay. And so can you be specific with sparingly? I know you said not daily, but say that there's a injury or just an aching knee pain, how often would sparingly be?
So what I tell our patients, if they have some sort of acute injury, so they hurt their shoulder or their knee and they need something for a couple of days for the pain, it's pretty safe in that situation. Same thing if they're using it for as a fever reducer when they're ill. That's okay. But if someone has chronic osteoarthritis or has a chronic pain that they intend to use this medication on an ongoing basis, those are the patients we really have to warn that, you could really do some damage to your kidney. So what I would tell people is if you're going to use it for more than 2 or 3 days in a row, you probably want to talk to either your nephrologist or your primary care physician to see if there's an alternative medication that you should use.
Okay. And then can you discuss some of the problems that these medications can cause by taking them too often?
Yeah, NSAIDs can do a lot of different things to our patients and their kidneys. So, you can get what we call an acute kidney injury, meaning your kidney function can go from whatever your normal is to, you have a more abnormal number over the course of even a couple of days. That's a more extreme
Wow.
example. But long-term damage is the main problem. It can cause fluid retention, some electrolyte disturbances on their blood work, and it can raise their blood pressure too.
Oh.
So that's why long-term usage, really can be detrimental to our patients.
So, Dr. Richey, we talked about elevated blood pressure when taking NSAIDs. Are there any other over-the-counter medications that patients should be aware of that elevate the blood pressure as well?
Yeah, absolutely. Over-the-counter medications such as pseudoephedrine, which is commonly used for its cold remedy for patients that have sinus stuffiness. It's a stimulant medication, and so it raises blood pressure. And along the same lines, there are some over-the-counter weight loss supplements that are somewhat popular, and they work the same way. They're stimulants, and they might induce a little bit of weight loss, but they also raise patients' blood pressure. So those are very important to know about. And then a lesser-known problem is licorice extract, and for that matter, actual licorice intake. And this is different than eating Twizzlers or something like that. But pure licorice extract definitely raises blood pressure. And so some people use that as a flavoring for coffee or tea, things like that. So they need to be aware that it could definitely affect their blood pressure.
Okay. And Are you able to give us like two examples of some of the weight loss supplements that you see people commonly taking that may stick out so that if they hear this talk, they can say, Dr. Richey said, this one would raise my blood pressure or that one.
Yeah. Um, I don't know the brand names because there's quite a few of them. I
Okay.
couldn't tell you that. But if you look on the back labels, what's the ingredient that you would most likely see is something called synephrine.
Epinephrine.
Yeah,
Okay.
and so if you see that, then just know that that's a stimulant medication and that could raise your blood pressure.
Okay. As you mentioned before, any medications that you're taking should be considered or approved first by your nephrologist. Now, one thing is it important to have patients bring all of the medications, all of the supplements that they're taking, including the prescribed ones, to their appointments with you. Would that be beneficial?
Absolutely. We recommend patients bring their list.
Okay.
A lot of times our patients have several different doctors. They're getting prescriptions from different people. They even the over-the-counter medications they take, they need to bring them in because their lists change on a regular basis, and so it's really, really helpful for us when patients bring their medications in. That way, we know exactly what they're taking and how much of what they're taking. So, yes, we do recommend people bring their prescriptions into their appointments.
And then just a quick side note. I know that if you are a Dallas Nephrology patient, you do have access to an online account, which is called Follow My Health.
Mhm.
And in that app, you're able to add medications, you're able to communicate with your nephrologist through that. So patients can, put that information in there as well as bring them to the appointment.
That's true. And several times a day, I get messages directly from my patients asking me, hey, can I take this? And that's been very helpful because if it's okay, I give them a thumbs up. If it's not, I explain why, no, please don't take that. Here's why. So, yes, if you have that option, especially for our patients,
Yes.
I highly recommend you take advantage of that.
Yes, exactly. That app is awesome. And so, can you give me some examples of alternative medications that can be used?
So, if we're talking about over the counter drugs, it's pretty straightforward. Tylenol or acetaminophen is pretty much the only medication that patients can use for the same indications. So, whether that's joint pain, fever, you're pretty much stuck with Tylenol for those indications, and it's completely safe for your kidneys.
Okay. And so now I know that we are in the times of holistic health and everybody wants to do the natural way and the homeopathic solution to things. Can you talk about herbal supplements?
Yeah, there's a lot of different supplements out there. And what I'll tell you, I'll give you some of the more concerning ones that we as nephrologists care about. Um, Chinese herbs, which again, there's a lot of them. Certain preparations of Chinese herbs can be very damaging to the patient's kidneys, and that's not on the bottle, by the way, when you get it.
Right.
So what I tell people is I don't expect them to understand which herbs are detrimental, but for Chinese herbs, talk to your nephrologist. Tell them what you want to take, why you want to take them. Let them, look that up for you if they don't know exactly what it is. That's probably the most concerning one. There's also herbal preparations out of India that have some concerning ingredients in them. So I think in both of those situations, rather than give patients exact names of these supplements, just know you need to touch base with your nephrologist before you take them. And beyond that, the other thing I tell patients is just be wary that all these herbal supplements are readily available. And a lot of times you actually don't know what's in them. Just because it says one thing on the bottle, especially outside of this country, some of these medications have other ingredients that you're not aware of. So,
Okay.
I always just tell them be careful, but make sure you tell us what you're taking.
Okay, good, good. That's extremely important to know because I know patients kind of, the internet is the information superhighway, and sometimes it can kind of steer them in the wrong direction. So I'm glad
Absolutely.
that you clarify that
Yeah.
and stress the importance of talking to your nephrologist. So what about vitamin supplements? We can go through the alphabet, A through D, A through E. Can you touch on those?
Typically, we use vitamin D very commonly. Vitamin D is used for a lot of different indications, but for our patients, bone health is very important because chronic kidney disease can lead to bone loss. So, vitamin D is generally speaking very safe. We don't have a lot of problems with that. As far as the other vitamins, A, B, E, we don't have a lot of issues with those. We don't use them on a regular basis, but they're safe. Vitamin C also is generally safe, but if you are a patient who has a history of kidney stones, you have to be very careful with long-term vitamin C usage. So, kidney stones, we usually restrict that, but for the rest of our kidney disease patients, it's relatively safe.
Okay. Okay. And then one of our final questions, caffeine. I know that we all need that extra boost.
Mhm.
So can you talk about caffeine and how that affects the kidneys?
Sure. Yeah, I get this question at least once a day. Caffeine is very safe. It's safe for the kidneys, doesn't cause any damage. There's always a concern about patients' blood pressure with caffeine intake. And while it is true that caffeine can raise blood pressure, it's not usually clinically significant. So if you're used to having 1 or 2 cups of coffee, I don't take those away from my patients.
Okay.
Now, if you're drinking 10 cups a day, we're going to have a discussion about that. But
Right.
otherwise, I consider caffeine to be pretty safe.
Okay. And so when you say that it can raise the blood pressure, so if a patient is, one of those that are have to take their blood pressure several times a day, how much of a jump should a patient see in that?
If they're used to consuming caffeine, you might see 4 or 5 points
Okay.
on their blood pressure number increase after drinking or taking in caffeine, but it wouldn't be much more than that.
Okay. All right. So we covered a lot today. We talked about the NSAIDs and making sure that you contact the nephrologist if you have questions about herbal supplements and just the natural vitamins that people can take. Is there any touch points that you want to kind of double back on that we may have kind of went over?
I really want to emphasize the NSAIDs.
Yes.
All right, we have a lot of patients whose kidneys are have declined significantly taking these medicines. So again, the take home from this is watch your NSAID usage. If you're not sure if you're taking an NSAID, again, call your doctor.
All right.
Okay.
All right. Well, thank you, Dr. Richey, so much for being with us today. You provided a wealth of information on something that is important because patients sometimes just, they have a headache, they run to the drugstore. So referring back to your nephrologist and running everything that you take through them is important.
Absolutely.
All right. Thank you so
Thank
much.
you.
Thanks for tuning in today. Learn more about Dallas Nephrology Associates at www.dneph.com. That's DNEPH.com. And if you found the information valuable, be sure to share with those who are impacted by chronic kidney disease.
Dallas Nephrology Associates DNA podcast series, Let's Talk About Kidneys, is provided for general information purposes only and does not replace the need to talk with a healthcare professional about your unique situation, care, and options. Our goal is to provide you with as much information as possible so you can be as informed as possible. Reference to any specific product, service, entity, or organization does not constitute an endorsement or recommendation by DNA. The views expressed by guests are their own, and their appearance on the program does not imply an endorsement of them or any entity or organization they represent. The views and opinions expressed by DNA employees, contractors, or guests are their own and do not necessarily reflect the views of DNA or any of its representatives. Some of the resources identified in the podcast are links to other websites. These other websites may have differing privacy policies from those of DNA. Please be aware that the internet sites available through these links and the material that you may find there are not under the control of DNA. DNA shall have no responsibility for the accuracy, legality, or content of the external site or subsequent links. Contact the external site for answers to questions regarding its content. The resources included or referenced in the podcast and on the website are provided simply as a service. DNA does not recommend, approve, or endorse any of the content on the linked sites. The content provided on this website and in the podcast is not medical advice and should not be used to evaluate, diagnose, treat, or correct any medical condition. The content is solely intended to educate users regarding chronic kidney disease, end-stage renal disease, ESRD, end-stage kidney disease, ESKD, and related conditions, and ESRD, ESKD treatment options. None of the information provided on this website or referenced in the podcast is substitute for contacting a healthcare professional.